Before you use that word shock again, allow me to carry us through what shock simply implies. Because for me, those days I used to use that word shock in place of bad news. Or me trying to tell someone I will surprise you. So I will say, I will shock you. I don't know for you, how do you use that word shock? Do you really know the extent for which that word implies? So on this very video, I'll be carrying us through the concept of shock, the possible causes of shock, what you should be on the lookout to know that someone has a shock, and then the complications that comes along with shock, the management of shock, and how important this very video is to both the medical personnel and to everyone out there. So first of all, what is shock? Shock is actually a life-threatening medical condition which is characterized by inadequate blood flow and oxygen delivery to the vital organs. All right. So when we say shock, we simply mean that three things. First of all, there is inadequate blood supply, and this blood carries the oxygen that we breathe in and the nutrients which comes from the food we eat. Either there is the inadequate supply of the blood or there is inadequate oxygen in that very blood which will be supplied to other parts of the body system. And then finally, inadequate circulation of this very blood. So let's see another definition. Shock can also be implied as the physiological disorder in which there is a reduction in tissue perfusion. It is the inadequate blood flow to a vital organ or the inability of tissue of the organs to utilize oxygen very well and other nutrients. So when other vital organs of the body system cannot utilize the available oxygen or the blood supply in terms of the nutrients to the desired standard, then shock has occurred. It involves a state of abnormal low blood pressure and a generalized severe circulatory inadequacy, causing a little or no perfusion to this individual body system. All right. Having said this, we are going to go into the possible types of shock. There are about 9 types of shock, and in this very video we'll talk about each of them. So the first one is the hypovolemic shock, and then the cardiogenic shock, the distributive shock, and then the obstructive shock. Then we also have what we call septic shock, we have what we call anaphylactic shock, we have what we call neurogenic shock, we have what we call endocrine shock, and finally the toxic shock. So before I go into the different types of shock, I want to give us an expression or an analogy to use to understand what shock, that concept, that very word shock, what it implies. So let's say there was the tank which carries water, the tank itself. From that tank, you need a host that will supply the water to other parts of the rooms of that building. All right. Then there are three important things here in this very concept. One, the tank itself that will host the water. Two, the host that will distribute the water to the building. And three, the aspect of the quantity of available water in that tank that will be delivered to the people. Meaning that the tank can be good, but there is no sufficient water to supply to the room. So there will still be scarcity of water, right? And then two, the tank can be good, there can be water, but the pipe are leaking. So where the pipe are leaking, there will still be that inadequacy of water supply, right? Or there will be water scarcity, to put in short. Now, the next thing that will happen is that where there is better tank, good host, sufficient water, is the system also able to utilize that water that is sent. So if you have the tank, you have the host, and you have the water, and you don't turn your tap on to be able to use that water, you don't use it. The water is just there. Its use is not seen, you get? So with this concept, you will now understand what we mean by shock, because shock happens when either that very tank which will supply the water is affected, and that tank here is the heart. Is it clear? Is the heart. Or the host which would have taken the water from the tank to other parts of the room. So that host now would be our blood vessel, either the arteries, the vein, or the capillaries. All right. Now that will take it from the heart to other parts of the body. Or there is inadequate water. That water now will be akin to the blood in the body system. All right. So when there is inadequacy of that very blood, you will now see shock can also occur, or the body part where the blood is being sent to cannot utilize that very blood supply, cannot utilize it very well, which is where the blood is supplied, the host is working when the tank is effective, is good enough, is in shape, but you are not using it. You get? So shock can also occur. So the first one is hypovolemic shock. When we talk about hypovolemic shock, we would liken it to the aspect of where there is inadequate water in that very tank. So what we mean is that inadequate blood in the system. All right. So what exactly is hypovolemic shock? As I've said, hypovolemic shock is that state where there is inadequate blood in the circulatory system, which is caused by severe blood or fluid loss. There are two things. Either it is blood that is lost or fluid that is lost. What are those things that could cause this loss of blood or fluid? We have burns, we have trauma, such as in accident cases, we have bleeding, we have things like dehydration, excessive use of diuretics, which will make this individual to urinate. Then we have extensive burns, prolonged diarrhea, and vomiting. These are the possible causes of this hypovolemic shock. This very type of shock is characterized by a decreased blood volume and cardiac output. I've already explained it earlier. The blood volume is decreased, and then what the heart is sending out will also be is also reduced. Okay, what are the possible symptoms to know that this individual is having hypovolemic shock? The first one is that there will be paleness of the skin, there will be a rapid heart rate. The heart rate, you see the heartbeat will be beating very fast, very fast, very fast. So there will be weak pulse. If you touch the pulse of that individual, it's actually weak in nature, right? So we have a decreased urine output because the fluid are lost. The urine, since the fluid are lost by other channels, the urine too will not be much. The individual will not be able to make enough urine. All right. So we'll go to the second type of shock, which is the cardiogenic shock. And in this one, we'll talk about cardiogenic shock. It's now akin to that very tank we talked about earlier, which is the heart. All right. So anything that affects the heart now will now be what will cause the result of this shock. So cardiogenic shock now is actually caused by heart failure or cardiac dysfunction. For instance, in cases of heart attack or cardiomyopathy. So in this case, cardiogenic shock can actually occur. All right. So we say that cardiogenic shock result from cardiac failure or inability of the heart to act as a pump therapy, which thereby deprive vital organs of blood supply. So having said this, what are the characteristics of this kind of shock? It is characterized by inadequate cardiac output and tissue perfusion. What we mean there is that since the heart it's actually dysfunctional. It cannot pump sufficient blood, which is the cardiac output now, cannot pump it out. And then the tissues that were supposed to be supplied with this blood will not have enough both oxygen and the nutrients through the blood. They will not have it. So, what are the possible symptoms to check out to know that this individual is having cardiogenic shock? The first thing to be on the lookout is the chest pain. The individual will complain, just like we talked about the aspect of the cardiomyopathy. The individual will complain of chest pain, very severe chest pain. We have shortness of breathing. There will be shortness of breathing. You will see that difficulty in breathing. Things like that. So the individual will be confused. There will be confusion. And then cold extremities is bound to be there. When you touch the hands of the individual, the legs will be very cold and clammy. Get? So when we talk about confusion now, confusion is in the sense of orientation. So the individual may be confused in the persons around him, the environment he finds himself, as well as the very timing. So having understood that, let's go to the third type of shock. And on this third type of shock, it's actually called distributive shock. Now, this aspect is where we were considering where this very water earlier, this water cannot be well distributed to other parts of the house. All right. So in this case, we're talking about the blood not being distributed accordingly to the various organs. So distributive shock occurs where there is an abnormal distribution of blood flow. Okay, so what are the instances that can cause distributive shock? We have sepsis, we have anaphylaxis, and then we have neurogenic shock, for instance. All right, this type of shock is characterized by vasodilatation and increased vasopermeability. What it simply means is that the blood vessel becomes enlarged. It becomes enlarged. And then things easily seep into the blood vessel. Okay? Now, what are the symptoms to know that this individual has distributive shock? We have warm extremities. The individual will have warm extremities, which is opposite to cardiogenic shock. In cardiogenic shock, remember we say cold extremities. But for this one, in the distributive shock, you have warm extremities, rapid heartbeat. The heartbeat will be rapid. A decreased blood pressure. If you check the individual blood pressure, it will be decreased. Now, that will take us to the fourth type of shock. This one is called the obstructive shock. So where that very water is to be supplied, and then there is things like sparrow, jara, dust, sand, and so on that are in that very host, which is obstructing its flow to any part of that room. So what we are talking about here is that there's an obstruction in the blood flow. Okay, so obstructive shock is caused by physical obstruction of blood flow. Now, what are those instances that can result in obstructive shock? Well, pulmonary embolism, where there is blood clot in the circulatory system, either in stagnant form or in a mobile form. All right, and then there is cardiac tamponade. So these are instances where obstructive shock can actually happen. And then how is it characterized? It is actually characterized by impaired cardiac filling and output. Right? It can actually reduce the rate for which the heart will supply those tissue. And then also, if it is towards the heart where there is that obstruction, the supply of blood will not be enough, will not be able to push out blood effectively. All right. So, what are those symptoms that one would know that there is an obstructive shock? Here, the individual will have chest pain also. The individual will have shortness of breathing, will have hypotension. When you check the individual blood pressure, it will be low. That's what we mean. Then there will be distended neck veins. So when you check the veins of that individual, the veins of the neck, you see it's actually prominent. So there's distended neck vein. So the next one is septic shock. All right. Now, in this septic shock, it happens where there is systemic infection. So that's why you have to take every infection very serious. You get me? If you do not get me, come closer again. Let's talk about it. I say whenever you are diagnosed of an infection, please don't play with it. Treat that infection. It can result in shock. So, septic shock is caused by severe infection and systemic inflammation. What are those instances that can cause this very septic shock? Sepsis itself, which I've said infection. Sepsis simply means infection. Then meningitis can also, which is inflammation of the meninges of the spinal cord. You get? So this can actually result in septic shock. For there to be inflammation of the meninges, it simply means that there is an infection in the spinal cord. There is inflammation. So please take every infection seriously and ensure you follow with your therapist or your physician and it's well treated. So, what are the characteristics of this kind of shock? It is characterized by vasodilatation and then increased vasopermeability and organ dysfunction. So, the blood vessels will be expanded, they'll be dilated, and then the things can easily seep into the blood vessel, and then there will be also organ dysfunction, which is depending on the part the part of the body that is being affected. So what are those possible signs and symptoms that you will know that this individual is having septic shock? There will be fever. Constantly you see that spikes in temperature. You can see either the individual is cold this moment, few moments away the individual become very hot like fire. Then you have chills. The individual can tell you is feeling cold inside, but when he touch the body, you see that the individual is very warm, or he can tell you is feeling very hot inside, but when you touch him outside, you notice that it's very cold. So there will be confusion where the individual is not oriented either to time, person, or place, and then there will be rapid heartbeat. There will be decreased blood pressure in this type of shock. So that will take us to the sixth type of shock, which we call anaphylactic shock. Now, this type of persons are persons that easily react to antigens or allergens. Do we get individual that reacts to allergens? So this type of shock is caused by severe allergic reaction. When there is a severe allergic reaction, it can result in anaphylactic shock. So, what are we saying? What are those instances that can cause this individual to come down with anaphylactic shock? We have food, for instance, food poisoning. Most of these tin foods, or beside the tin food too, foods such as beans, which are preserved with chemicals. These chemicals in either the bag, in the packaging, or in the tin can actually act as toxins to the body system, thereby resulting in anaphylactic shock. Medications too, excessive. That's why you need to stick to what is prescribed. Please, whenever medications, don't self-medicate. Meet your physician to be the one to prescribe the drug for you. And when you notice any complaint, don't keep it. Immediately voice out so that there can either be an adjustment in the dosage or switch in the medication. So, insect bite can result in this too. I have seen a case where bee actually bite a particular child and the entire face changed. The entire face changed. Instances like that can result in anaphylactic shock. Snake bite, those kind of things can result in it. So, including pollen grains, we get. So, any allergic reaction that is systemic in nature is sufficient enough to cause anaphylactic shock. So this type of shock is characterized by a rapid onset of symptoms, which include vasodilatation and increased vascular permeability. All right, what do we mean? We mean that this type of shock can occur in split seconds. They can occur, they don't waste time. The progression is rapid in nature. It's actually rapid in nature. That's why when you are reacting to something, look for aid immediately. Look for aid, either first aid or medical aid, medical attention immediately. So, what are those symptoms you should look out for to know that this individual is having anaphylactic shock? One, we have the IFs. IFs is an instance. Itching is another instance. Swelling. Now, this itching we're talking about is severe form, which you know is coming from a reaction. And then swelling. There will be that swelling in that individual. That part, you see the part is swollen, the part is itching. There is ifs there. And then there's difficulty in breathing. And then a rapid heartbeat for this individual. You check the pulse. It's actually very rapid. That will take us to the seventh type of shock. And this seventh type of shock is called neurogenic shock. All right? Neurogenic shock, it results from anything that will affect the nervous system. So, neurogenic shock is caused by spinal cord injury or the neurological dysfunction. So, what did we say? We are saying that where the individual has spinal cord injury, it can result in neurogenic shock. And where there is neurological dysfunction, meaning other parts of the nervous system, such as the nerves, are affected, then there can be that a neurogenic shock. For instance, this type of shock is characterized by the loss of sympathetic tone and vasodilatation. Now, know that the nervous system is what is in charge in impulse perception, impulse interpretation, and the return of appropriate signals. For instance, what I mean is that someone touches you, it is the nervous system that will let you know to receive that sense of touch. We'll send it to the brain, and the brain will interpret what type of touch is that. You get? And then will now let you know the appropriate action to respond based on that touch. So when there is dysfunction in this nervous supply wiring, there can be a possibility for neurogenic shock to occur. The following symptom would signify the presence of neurogenic shock. 1. Hypotension. You check the blood pressure, it is low. Bradycardia. The pulse rate is low. Warm extremities. You see the individual hands, the legs, and so on, they are very hot. Decreased reflexes. So the individual cannot respond to impulses very well. Let me also let us know that that's aspect where you hear bad news and you run into shock. It's classified under this neurogenic shock. All right. So it is actually a type of shock which is also referred to as fainting or syncope. It is also referred to as fainting or syncope. It occurs as a result of a failure of arterial resistance due to psychological or sensory stimulation, as in the case of fear. Where there is excessive fear, it can lead to neurogenic shock. Where there is shocking news, it can lead to neurogenic shock. For instance, the loss of loved one, loss of employment, including even good news. Good news too, not just bad news, causes neurogenic shock. Good news too. That's why in breaking news, please ensure the individual will be able to bear it. Not everybody can bear both the positive and negative emotions. So, overexcitement can result in neurogenic shock. Bad smell. That's why you need to move away from areas where you perceive the smell is very malodorous. Move away from it. We have spinal anesthesia can also lead to this particular type of shock in some instances. So the next one we'll consider on our list is actually the endocrine shock. So this type of shock is caused by hormonal imbalances, which will result in instances such as adrenal insufficiency and thyroid crisis. So what I'm talking about is that the adrenal system will supply the epinephrine, norepinephrine, and the cortisols. Where there is insufficiency in these adrenal supplies, there's possibility for the endocrine shock to occur. And then the thyroid gland will supply the calcitonin, the tyrosine, and then the triiodotyrosine, which is T3 and T4 and T3. So where this thyroid gland is defective, there can be the thyroid crisis. All right. So this type of shock is characterized by impaired vascular response and cardiac output. Impaired vascular response and cardiac output. What we simply mean is that your blood vessel, the nerves connected to it, are not fast to pick it up that there is blood loss. For instance, there is blood loss or there's insufficient blood supply, so that the brain can be able to compensate in a way which we call the negative feedback system. It will now result in what we call endocrine shock. What are the symptoms to look out for in endocrine shock? We have hypotension, where you measure the individual blood pressure, it will be low. Weakness, the individual will complain of weakness. In fact, the endocrine system is what is responsible for you mostly either to be active or inactive. And where I'm referring to is hormones such as the adrenaline and noradrenaline, as well as the thyroid hormones, are the ones that will be able to keep you either active or inactive. So we have what we call the electrolyte imbalances, where you are actually lost fluid for a longer time. So you may lost, and the most common electrolytes that play a role in this type of shock are the sodium and the potassium, as well as the calcium too. Calcium, they play a role here because they are mostly responsible for tissue or muscular activities. So the last one is the toxic shock. This type of shock is caused by exposure to toxins. For instance, bacterial toxins, chemical exposures. There are certain chemicals. This can be akin to someone being poisoned, someone being directly poisoned with chemical. So this type of the person is actually dying from this type of shock, which is the toxic shock. Okay, so this type of shock is characterized by systemic inflammation and organ dysfunction. So this toxin would cause inflammation of the system, and then there will be organ dysfunction. And if the organ happens to be the heart, it will shut down the heart. Okay, so the symptoms to look out for to know the individual is suffering from toxic shock includes but not limited to fever. The individual will be very hot. Chills can be hot inside, you touch outside, is cold. Can be cold inside, you touch outside, is warm. Confusion, which is either disorientation to person, time, or place. Rapid heartbeat, if you touch the pulse of that individual, it is very high. Decreased blood pressure can also be seen in this very individual. So having said this, we'll now go to how does this type of shock, let's just trace one part where how this type of shock occur. Where there is blood lost, for instance, in case of accident, the negative feedback system will send information to the brain, telling the brain that there is an injury that has occurred, hence blood is lost. This very negative feedback will spur a response where there will be vasodilatation, in the sense that the blood supply want to supply, compensate to supply well to other parts. And then there will be vasoconstriction for the major blood vessels, vasodilatation for the smaller blood vessel, but vasoconstriction for the larger ones, so that too much fluid will not be lost, or too much blood will not be lost. And where this blood loss is not handled on time, it can result in, because the individual is not getting fluid at the same time too, it can result in a reduction in cardiac output, which will now still result in subsequent reduction in the arterial regions, which thereby reduce tissue perfusion. What we mean is that there will be reduction in blood supply to other tissue, because there is no aid to arrest that shock. And then other tissue that would have been supplied would be lacking these vital nutrients, such as oxygen and other nutrients. We get? Now the body will now still try to compensate, still through that very negative feedback system, which is responsible in the case of where there is an issue in the body system. The nervous system and the endocrine system will try to arrest it. It's a natural pathway that the body is being wired to arrest negative outcome or negative issues in the body, within the body system. All right, so it tries to compensate while expecting aid. Now we have the blood vessel will further constrict. What we mean is that they will tighten up, trying to reduce the amount of blood lost or fluid lost. And when this continues, there will be the antidiuretics. Remember, in the causes of shock, we say that when you take excessive diuresis, which will, for instance, laxis, which will cause you to lose enough blood, at the same time would lose sodium. In this case, where the negative feedback system is activated, there will be release of antidiuretics, which will reduce the level of fluid that is lost, will cause fluid retention, and at the same time, there will be retention of sodium. So where there is actually continuous loss of this blood, there's no medical attention in terms of first aid or taking the individual to the hospital at once. So it will actually continue to the point where the heart can no longer push blood, because there's no sufficient fluid or blood in supply. And then it will now result in the various signs and symptoms of shock, which is dependent on the organ being affected. So for instance, for the skin, the response will be in terms of fever. That thermoregulatory function will be lost. So can either be cold or warm, or there will be chills. And then the heart, you can have a fast heartbeat or heart rate. There will be hypotension, there will be increased blood pressure, there will be all those symptoms that comes along, as we mentioned earlier. An instance where the renal system does not have sufficient perfusion, it can lead to things such as oliguria, where there will be absence of or insufficient urine being produced. Either absence of it, anuria, or there will be oliguria, where the individual cannot make urine or they cannot make sufficient urine. And then can even result in acidosis, which is the body becomes toxic. There will be accumulation of waste products in the body. Now, that will take us to the management of shock. The first step in management of shock has to do with early identification. You can identify it fast, which is why we make this very video. So please be on the lookout, and if you have not carefully followed through from the beginning of this video, you can still rewatch the video, check it up again, so that you'll be conversant with the various signs and symptoms to be on the lookout for. And then the second one is to ensure a patent airway. Ensure that tight clothings are loosened, the windows are actually open, especially when the individual is taken to the hospital. The close by windows are open. There will be a regulated temperature, atmospheric temperature to the individual, because if you overexpose him to any of the extremes, it can aggravate the issue. So the individual tight clothing should be loosened so that it doesn't uh, reduce the rate at which the individual can be able to take in more oxygen or breathe very well. And then the leg of the bed should be elevated in this case, and he should also have constant monitoring of his blood pressure. He or she, there should be constant monitoring of blood pressure and other vitals. And then they should keep the patient always warm, more especially where the individual is having cold extremities. And the blood fluid should be restored. Now this will be done at the hospital. So there will be fluid replacement therapy is very essential, very essential. So there should be fluid resuscitation and fluid transfusion. Then vasopressors as well as inotropes will be used to support the individual blood pressure and output. What we simply means there are medications that will be given to retain fluid and sodium to help increase cardiac output, and then will also, for where there is excessive workload, also filter off some of those waste products. Then there should be antibiotics and anti-inflammatory administered on this individual depending on the cause. Okay, for instance, we talked about the anaphylactic, the toxic shock, and so on. Those ones, the septic shock. So that factor that caused it should be identified. Once identified, treatment should be given accordingly. Now, supportive care in the sense oxygen and ventilation as well as monitoring should be given to that individual. So when we mean supportive care, it means other things that are not really medications. So oxygen should be used to help the individual breathe well. Then the room should be well ventilated. It shouldn't be overcrowded. It shouldn't be overcrowded. There should be constant monitoring. All right. So having said that, what are the possible complications to expect from shock? One, there'll be tissue damage because they have not received enough nutrient and oxygen, especially that of the brain. The brain cannot survive very well, even few seconds without oxygen or other nutrients such as glucose. It cannot function very well. So there can be brain damage, there can be tissue damage, there can also be acidosis, which is resulting from increased as accumulation of waste products. There can even be death as the end form of the complication. So the individual can have prolonged confusion as well as other mental health related complaints. Having said that, how important is this very discussion to the healthcare personnel as well as other persons? Shock can lead to organ failure and death if left untreated, so it should be treated as issue of urgency. Early intervention improves survival rates and reduces the morbidity and mortality rate. So if care and management is given on time, the individual can actually be resuscitated and brought back to life. Healthcare providers must be vigilant in identifying shock and initiating timely treatment. So healthcare providers as well as other persons too should be able to identify the shock on time and then do the supportive management they can in terms of first aid and then refer the individual to the hospital. They should also be able to hand over properly what has been done for the individual or before the arrival of the ambulance. Having said this, I believe this very video has been useful to us. Let me know in the comment box how useful this information is to you. And then I look forward to that very moment where this very channel becomes your most favorite click. Thank you so much for staying this far. God bless you.